I was part of the Second Degree Accelerated August 2013 graduating class. We had TeamSTEPPS implemented into our course curriculum during our practicum experience. Many of us thought it was kind of a waste of time. Why would you need to get together one more time as a group? Little did we know the long-lasting impact the TeamSTEPPS would have on not only our cohort, but also on our practice as we went forward. During the TeamSTEPPS experience, not only did we watch vignettes, but we were able to use teamwork activities to learn about each other a little bit more and to develop relationships with one another. Now in practice, when you go beyond the TeamSTEPPS, you don't realize during the experience how much you're going to take away. You think it's just a one day, how much can it impact you? But truthfully, when you're in the experience and learning about one another and begin to use the words that help you use synonyms during your practice, that's when it becomes important. So initially, didn't think I was going to use it too much, but once I began to practice, especially in the nursing field, I used TeamSTEPPS on a daily basis. I've used it when I was working in the emergency room. I use the CUS. CUS seems to be the term that has followed me in my practice. I am concerned, I feel uncomfortable, and safety is at risk for me. So working with a patient in the ER, we were concerned because the physician had suggested pushing medication far beyond the recommendation times. It was easy to quickly throw in CUS, even though I was a new grad nurse, and say I'm concerned, I feel uncomfortable, and the safety of my patient is at risk. And the physician stopped immediately, reviewed the order, reviewed what he was doing, and actually stopped pushing the medication and said, you're right, we really need to review what we're doing because the safety of the patient is at risk at this time. Not only that, but I've been able to use it on a day-to-day basis in my practice when working with other nurses and talking about how concerned I am about the patient, uncomfortable I get, and once again the safety. I'm often in a situation in which I have to put in orders or work with patients on a one-to-one basis, and the physicians are not always available. In that situation, I always use the CUS acronym. You know, at Ursuline College, we were definitely given the values, voice, and vision, which is the mission of the college. And TeamSTEPPS pushes you along and allows you to be able to use your voice when working with patients and impact their lives on a daily basis.